What are the key components of an effective disease prevention and control program in animal care, and how should these components be implemented to minimize the risk of disease transmission? Answer: an effective disease prevention and control program in animal care must focus on the following key components: vaccination protocols, ensuring that animals receive appropriate vaccinations for preventing diseases. This includes understanding species-specific vaccine schedules and the timing of boosters. Quarantine and isolation, implementing protocols for isolating animals that show signs of illness or have been exposed to contagious diseases to prevent spreading to healthy animals. This can involve creating separate isolation areas with controlled access, sanitation and hygiene, regular cleaning and disinfecting of animal enclosures, equipment, and areas where animals are housed is critical to prevent cross-contamination. This involves using appropriate disinfectants and ensuring proper ventilation, monitoring and surveillance. Regular health checks and monitoring for early signs of disease help in quickly identifying issues and taking corrective action. It is important to apply these principles consistently, adhering to the guidelines set forth by regulatory bodies like the Centers for Disease Control and Prevention (CDC) and World Health Organization (WHO) for zoonotic disease management. Explain the concept of zoonotic diseases and how animal care providers can minimize the risk of zoonotic transmission in a care facility. Answer: zoonotic diseases are infectious diseases that can be transmitted from animals to humans. They can pose significant health risks to both humans and animals, and it is essential for animal care providers to mitigate this risk. To minimize zoonotic transmission, the following steps should be followed. Personal protective equipment (PPE). Staff should be trained to wear appropriate PPE, such as gloves, masks, and gowns, especially when handling animals known to carry zoonotic pathogens. Hand hygiene. Regular and thorough hand washing before and after handling animals is crucial to prevent the transmission of zoonotic diseases. Vector control. Managing vectors like ticks, fleas, and mosquitoes that can transmit zoonotic pathogens, e.g. Lyme disease, West Nile virus, is essential. Education. Staff and clients should be educated on the risks of zoonotic diseases, including common symptoms and preventive measures. Health monitoring. Regular health checks for both animals and humans in the care facility can help detect potential outbreaks early. Why is it crucial for animal care providers to have a thorough understanding of parasite identification, and what steps should be taken to treat common internal and external parasites in animals? Answer: proper identification and treatment of parasites are critical to ensuring the health and well-being of animals in care. Parasites can cause a range of health issues from mild discomfort to severe illness or death. Identification. Animal care providers should be trained to recognize the symptoms of common internal e.g. roundworms, tapeworms, and external parasites e.g. fleas, ticks, through observation, fecal testing, and blood analysis. Treatment. Effective treatments involve the use of veterinary-approved medications such as anthelmintics for internal parasites and insecticides for external parasites. Care providers must follow dosage guidelines to ensure efficacy and safety. Prevention. Preventive measures including regular deworming schedules and flea tick control programs can reduce the likelihood of parasite infestations. Sanitation. Ensuring that the environment is clean and free of parasite eggs or larvae is key to preventing reinfestation. This includes disinfecting enclosures, bedding, and toys. Treatment and prevention must align with veterinary guidance and industry standards to avoid resistance and ensure the health of both animals and care staff. What are the primary hygiene practices that should be implemented in animal care facilities to prevent the spread of disease, and how should they be maintained? Answer: maintaining cleanliness and hygiene in animal care facilities is paramount to disease prevention. Key hygiene practices include regular cleaning and disinfection. This involves cleaning floors, surfaces, cages, and equipment with appropriate disinfectants. Staff should follow a routine cleaning schedule to prevent the accumulation of pathogens. Waste management. Animal waste should be disposed of promptly in a safe and sanitary manner to prevent contamination of living spaces and food water sources. Ventilation. Proper ventilation reduces moisture and airborne pathogens, which helps to minimize the risk of respiratory infections. Hand hygiene. All personnel must be trained in proper hand-washing techniques and the use of hand sanitizers to ensure the prevention of cross-contamination between animals. These practices must be regularly reviewed and updated to align with OSHA and CDC guidelines for infection control. Mr. Adams is the head of an animal care facility, and one of the new puppies under his care starts showing signs of diarrhea, lethargy, and vomiting. The puppy was recently vaccinated but had been in contact with other animals in the facility that could be sick. What steps should Mr. Adams take to manage this situation while preventing potential disease spread? Answer: Mr. Adams should take immediate action to manage the sick puppy and minimize the risk of disease transmission. Isolation: the puppy should be immediately isolated from other animals to prevent potential contagion even if it has been vaccinated. Isolation should take place in a separate quarantine area. Veterinary consultation: Mr. Adams should arrange for the puppy to be seen by a veterinarian as soon as possible to diagnose the underlying cause of the symptoms. The veterinarian may request fecal tests or blood work. Disinfection and hygiene: the area where the puppy has been housed should be thoroughly cleaned and disinfected, especially if the puppy has had contact with other animals or areas in the facility. Monitor other animals. Any other animals that have been in close contact with the puppy should be monitored closely for symptoms. They should be quarantined until they are cleared by a veterinarian. Communication: staff and clients should be informed of the situation, and precautions should be taken to prevent any other animals or humans from being exposed to the illness. Explain the ethical considerations and best practices for animal handling and restraint that minimize stress and injury to the animal. Answer: ethical considerations in animal handling and restraint revolve around minimizing stress, fear, and physical harm to animals. Best practices include species-specific restraint. Different species require different handling techniques. For example, small animals like rabbits should be gently cradled to avoid injury, while larger animals like dogs may require different forms of restraint, such as leashes or harnesses. Positive reinforcement: using rewards, e.g. treats, praise, can help reduce stress and encourage cooperation during handling. This helps in building trust between the animal and the caregiver, avoiding overrestraint. Restraint should be just enough to safely manage the animal without causing unnecessary discomfort. Overrestraining can result in physical injury or long-term behavioral issues. Training: staff must be well trained in humane restraint methods to ensure they can effectively manage the animals without causing harm. Training should also cover how to recognize signs of stress and distress. Ethical guidelines, such as those set out by the American Veterinary Medical Association (EVMA) and American Humane, emphasize the importance of minimizing animal suffering. Why is it important for animal care providers to understand species-specific handling techniques, and what are some considerations for safe handling of exotic animals? Answer: species-specific handling techniques are crucial because different animals have unique behaviors, temperaments, and physical structures that require tailored approaches to ensure safety for both the animal and the handler. For exotic animals, such as reptiles or birds, the following considerations must be made. Understanding behavior: exotic animals may have more specialized stress triggers or defensive behaviors, e.g., biting, flying, or striking. Understanding these behaviors allows handlers to anticipate reactions and avoid injury. Physical requirements: exotic animals may have specific requirements regarding temperature, humidity, and enclosures. Proper handling ensures that these conditions are maintained, reducing stress during interactions. Use of specialized equipment: for some exotic animals, such as snakes or large lizards, handling may require specialized equipment like hooks or gloves to ensure the handler's safety and the animal's well-being. These handling guidelines align with Animal Welfare Act standards and should be followed to prevent harm. What factors should an animal care provider consider when choosing a restraint method, and how can humane restraint methods be implemented to ensure the animal's welfare? Answer: when choosing a restraint method, animal care providers must consider the following factors: animal size and strength. A large, strong animal may require more robust equipment like a leash or muzzle, while smaller animals may only need gentle handling or soft carries. Animal temperament: a calm animal may only need minimal restraint, whereas an aggressive or fearful animal may require more control, such as a restraint jacket. Health status: animals with injuries or certain health conditions may require specific restraint methods to avoid exacerbating their condition. Safety for handler and animal: the primary goal of restraint is to prevent harm. Methods should be chosen based on safety considerations for both the animal and the handler. The humane restraint methods should follow guidelines from the AVMA and other ethical bodies to ensure that restraint is applied with the least stress and discomfort to the animal. What are the primary ethical considerations that an animal care provider must keep in mind when making decisions about animal care, and how can these be integrated into daily practices? Answer: ethical considerations in animal care include animal welfare. The well-being of the animal must always be the primary concern, ensuring that the animal's physical and psychological needs are met. Minimizing stress. Restraint, handling, and medical procedures should be done in a way that minimizes stress, fear, and pain for the animal. Informed decision-making. Animal care decisions should be based on sound veterinary advice and be made with the animal's long-term welfare in mind. Transparency and accountability. Care providers should be transparent with clients and staff about the care animals are receiving, and ethical decisions should be documented and reviewed. Ethical frameworks from organizations like the AVMA and World Animal Protection provide guidance on making these decisions. What is the role of isolation and quarantine procedures in controlling infectious diseases in animal care facilities, and how should these procedures be effectively implemented? Answer: isolation and quarantine are critical in controlling the spread of infectious diseases in animal care facilities. The role of these procedures includes preventing disease spread. Isolation ensures that animals suspected of being sick or exposed to infectious diseases do not come into contact with healthy animals. Time frame for quarantine. Animals should remain in quarantine for the duration of their incubation period to monitor for symptoms. This time frame can vary depending on the disease, but should align with veterinary recommendations. Separation from healthy animals. Quarantined animals should be housed in separate enclosures with restricted access, and staff handling them should wear protective gear. Monitoring and testing. Regular health checks and diagnostic testing should be conducted on quarantined animals to confirm whether they are free of infection before being integrated into the general population. These procedures are in accordance with guidelines from the CDC and VMA to prevent outbreaks in animal care facilities. How do the structures of the skeletal system contribute to an animal's overall mobility and strength? Answer: the skeletal system serves as the framework that supports the body, protects vital organs, and provides structure to the body. It is composed of bones, cartilage, ligaments, and tendons. Mobility and strength are achieved through the interactions of bones, muscles, and joints. Bones provide leverage and act as rigid support structures. Joints allow for the movement of bones relative to each other. Joints can be classified into three types: synovial, cartilaginous, and fibrous. Synovial joints, like those in the limbs, allow for a wide range of motion. Muscles are attached to bones via tendons. When muscles contract, they pull on the bones, causing movement at the joints. For example, in mammals, the ball and socket joint of the shoulder allows for extensive arm movement. Bone density and composition also impact strength. For instance, compact bone provides structural strength, while spongy bone offers flexibility. Explain the role of the respiratory system in maintaining oxygen and carbon dioxide balance in the body of a dog. Answer: the respiratory system in dogs consists of the nasal cavity, trachea, bronchi, bronchioles, and lungs. The primary function of this system is to facilitate gas exchange. Oxygen from the environment is absorbed into the bloodstream, and carbon dioxide, a waste product, is expelled from the body. Inhalation. When a dog inhales, air enters through the nose, where it is filtered and warmed before reaching the lungs. Gas exchange. In the lungs, oxygen diffuses from the alveoli into the bloodstream, while carbon dioxide moves from the blood into the alveoli to be exhaled. Exhalation. The dog exhales, removing carbon dioxide from the body. The respiratory system is regulated by feedback mechanisms involving chemoreceptors in the brain and arteries, which monitor the levels of oxygen and carbon dioxide, ensuring the balance is maintained. The Canine Respiratory Health Guidelines by the American Veterinary Medical Association highlight how conditions like canine respiratory diseases, e.g., kennel cough, can disrupt this balance. What are the most common signs of digestive system distress in a cat, and how should an animal care provider address them? Answer: common signs of digestive distress in cats include vomiting or regurgitation, diarrhea or constipation, loss of appetite, anorexia, abdominal pain or bloating, lethargy, or changes in behavior. Causes can range from dietary indiscretions, infections, e.g., gastrointestinal parasites, or diseases like inflammatory bowel disease, and intestinal obstruction. Approach to care: assess diet. Determine if there has been any recent change in diet or access to harmful foods. Diagnostic tests. A veterinarian may conduct stool tests, blood work, and imaging, ultrasound, or X-rays to identify infections or blockages. Treatment. Treatment can include dietary changes, e.g., switching to a more digestible food, medications for pain or inflammation, and fluids for hydration if vomiting or diarrhea is severe. Mr. Thompson is a dog owner who has noticed that his dog, Buster, is frequently urinating and drinking water excessively. He is concerned about his dog's health. What steps should Mr. Thompson take, and which conditions should he consider? Answer: Mr. Thompson should consider the following steps. Visit a veterinarian. Excessive urination and thirst, known as polyuria and polydipsia, are often signs of underlying health issues such as diabetes mellitus, kidney disease, or Cushing's disease. Diagnostic testing. The veterinarian will likely conduct a blood test, urinalysis, and possibly an ultrasound to diagnose the underlying condition. Diabetes can be diagnosed with elevated blood glucose levels and glucose in the urine. Treatment. If diagnosed with diabetes, for example, Buster would need insulin therapy and a strict dietary regimen to control his blood sugar levels. Kidney disease may require dietary changes and medications to support renal function. Regulatory guidelines. American Animal Hospital Association (AHA) outlines diagnostic and treatment protocols for diseases like diabetes and kidney failure, ensuring animals receive the proper care. In animals, what is the role of the endocrine system and how does it regulate metabolism and growth? Answer: the endocrine system in animals is made up of glands that secrete hormones directly into the bloodstream. These hormones regulate various physiological processes, including metabolism, growth, reproduction, and immune function. Key hormones involved in metabolism and growth include thyroid hormones and produced by the thyroid gland. These hormones regulate the metabolic rate by influencing the speed at which cells convert nutrients into energy. Growth hormone, GH, secreted by the pituitary gland. GH stimulates growth, particularly in bone and muscle tissues. Insulin, produced by the pancreas. Insulin regulates blood sugar levels and energy storage. Dysfunction in these hormones can lead to metabolic disorders like hypothyroidism, or growth hormone deficiencies. Regulatory framework. The veterinary endocrinology guidelines provide recommended procedures for diagnosing and managing endocrine disorders in animals, with an emphasis on early detection and proper hormonal regulation. What is the importance of water in the diet of ruminant animals, and how does it affect digestion? Answer: water is crucial in the diet of ruminants like cattle, sheep, and goats due to its role in various bodily functions. Digestion. Water is necessary for the rumen fermentation process. It aids in breaking down fiber and helps in the absorption of nutrients from the digested food. Temperature regulation. Ruminants are more prone to heat stress, and water helps regulate body temperature. Transport of nutrients. Water is a key component in the transportation of nutrients throughout the body via the bloodstream. A lack of adequate water can lead to dehydration, reduced feed intake, and poor digestion, which in turn can reduce milk production and growth rates. Legal guidelines. The National Animal Nutrition Program and Animal Welfare Act emphasize the need for providing fresh, clean water at all times, particularly for ruminants in agricultural settings. What are the physiological impacts of an iron deficiency in young puppies, and how should it be managed? Answer: iron deficiency in puppies can lead to anemia, a condition where the body has insufficient red blood cells to carry oxygen. Symptoms include lethargy, weakness, poor growth, pale gums. Iron plays a key role in hemoglobin production, which is necessary for oxygen transport. A deficiency impairs oxygen delivery to tissues, leading to the symptoms above. Management. Dietary adjustment. Iron-rich foods such as organ meats, egg yolks, or fortified puppy foods should be included in the diet. Supplementation. In severe cases, veterinarians may administer iron supplements to restore normal levels. In what ways does the nervous system of an animal control involuntary functions, and what are some examples of disorders that can affect these functions? Answer: the nervous system controls involuntary functions through the autonomic nervous system, which includes the sympathetic and parasympathetic divisions. Sympathetic activates the fight or flight response, increasing heart rate, dilating pupils, and inhibiting digestion during stress. Parasympathetic promotes rest and digestion by slowing the heart rate and stimulating digestive processes. Disorders that affect involuntary functions include autonomic neuropathy, a condition where nerve damage affects the ANS, leading to abnormalities in heart rate, blood pressure, or digestive function. Seizure disorders, caused by abnormal electrical activity in the brain, which can disrupt normal involuntary functions like breathing or heart rhythm. Regulatory guidelines. The American Veterinary Neurology Society outlines diagnostic and treatment approaches for neurological disorders in animals, including the management of autonomic dysfunction. How does a high-fiber diet benefit herbivorous animals, and what are the risks associated with low-fiber intake? Answer: a high-fiber diet is essential for herbivorous animals as it supports proper digestion and gut motility. Fiber promotes rumen fermentation in ruminants and intestinal health in non-ruminants. It helps prevent constipation by facilitating the movement of food through the digestive tract. Obesity by creating a feeling of fullness without excessive caloric intake. A low-fiber diet can lead to digestive issues such as bloat, colic, or intestinal blockages. Regulatory guidelines. Animal nutrition guidelines from the World Small Animal Veterinary Association (WWF) have stressed the importance of fiber in maintaining gastrointestinal health in herbivores. What is the relationship between animal metabolism and the endocrine system, specifically focusing on thyroid hormone regulation? Answer: the thyroid glands, located in the neck, produce thyroid hormones (T), which regulate the animal's metabolism. These hormones control the rate at which cells produce energy by influencing processes like protein synthesis and oxygen consumption. Hyperthyroidism. Overproduction of thyroid hormones leads to an accelerated metabolism, which can result in weight loss, increased heart rate, and excessive thirst. Hypothyroidism. Insufficient thyroid hormone production causes a slow metabolism, leading to weight gain, lethargy, and skin issues. Legal and regulatory guidelines. Veterinary endocrinology protocols ensure proper management of thyroid conditions, emphasizing diagnosis through blood tests and treatment via medication or hormone replacement therapy. What are the key components of effectively explaining animal care practices to a client, and why is it important to provide this information in a way that is tailored to the specific needs of the pet and the owner? Answer: when explaining animal care practices, it is essential to understand the client's knowledge level, tailor the information based on whether the client is a first-time pet owner or has extensive experience. Use clear and simple language. Avoid jargon that may confuse the client. If medical terms are necessary, ensure they are explained. Provide written instructions. Offer post-care instructions in writing for the client to reference later. This can reduce misunderstandings and ensure consistency in following care practices. Discuss pet-specific needs. Different animals have unique care requirements, e.g., species, age, or health condition. Always address these specifics, such as feeding schedules, activity levels, or medical treatments. Explaining care practices is critical for ensuring the health and well-being of the animal. Clients who are well informed are more likely to follow through with proper care, reducing the risk of complications and improving the animal's quality of life. What is the significance of animal protection laws, and how do these laws impact an animal care provider's responsibilities toward the animals they care for? Answer: animal protection laws are designed to prevent abuse, neglect, and exploitation of animals. These laws outline the minimum standards of care that must be provided to animals under the care of professionals. The key components of animal protection laws typically include duty of care. Providers are legally obligated to ensure that animals in their care receive proper shelter, food, water, and medical attention. Failure to meet these standards can result in legal penalties. Reporting abuse or neglect. Care providers have a legal duty to report suspected cases of animal abuse or neglect to relevant authorities such as local animal control or humane societies. Compliance with licensing requirements. Many jurisdictions require animal care providers to be licensed or certified. These requirements help ensure that providers meet certain standards and have the necessary skills to care for animals properly. Failure to adhere to animal protection laws can result in legal actions, including fines, loss of license, and even imprisonment. Animal care providers must stay informed about the specific laws in their region and maintain professional conduct at all times. Why is it crucial for animal care providers to maintain up-to-date licenses and certifications, and what steps should a provider take to ensure compliance with these requirements? Answer: licensing and certification requirements serve as a form of regulation to ensure that animal care providers are competent and knowledgeable. These certifications typically verify that a provider has completed specific training in animal care practices and is aware of legal and ethical responsibilities. Key reasons for maintaining up-to-date certifications include professional credibility. Certification assures clients that the provider has met industry standards and possesses the necessary skills and knowledge. Legal compliance. In many jurisdictions, maintaining a valid license is legally required to provide certain services, such as veterinary care, grooming, or animal training. Continued education. Many certifications require ongoing education, which helps the provider stay current with best practices and new developments in animal care. To ensure compliance, animal care providers should regularly check renewal dates and submit necessary paperwork, participate in continuing education or training programs to meet ongoing education requirements, familiarize themselves with any changes in the regulations governing animal care in their jurisdiction. Mr. Smith, a first-time dog owner, has recently adopted a rescue dog. He is unsure about the responsibilities involved in caring for his new pet and is seeking your guidance. What steps should you take to educate Mr. Smith on his responsibilities as a dog owner? Answer: When educating Mr. Smith on pet ownership responsibilities, the following steps should be taken. Start with basic care information. Provide information about essential dog care, such as feeding, grooming, exercise, and veterinary visits. Explain that dogs require regular walks, a balanced diet, and proper grooming to maintain their health. Discuss health and medical care. Explain the importance of regular veterinary checkups, vaccinations, parasite prevention, e.g., flea, tick, and heartworm, and emergency care. Address behavioral training. Emphasize the significance of training and socialization, especially for a rescue dog who may have experienced trauma. Advise on basic commands, crate training, and positive reinforcement methods. Provide resources. Offer brochures or online resources for first-time dog owners and recommend local training classes or community groups for additional support. Offer ongoing support. Let Mr. Smith know that you are available for further questions or follow-ups, ensuring he feels supported throughout the process. What are the primary types of liability that animal care providers may face, and what measures can be taken to mitigate these risks? Answer: animal care providers may face several types of liability, including negligence. If an animal care provider fails to meet the standard of care, e.g., leaving an animal unattended or failing to administer prescribed medication, they could be held liable for any harm caused. Vicarious liability: if an employee or contractor working under the animal care provider's supervision causes harm to an animal or client, the provider may be held responsible. Contractual liability: if the provider enters into an agreement with their client, e.g., boarding services or training contracts, and fails to meet the agreed upon terms, they may be liable for breach of contract. To mitigate these risks, providers should maintain insurance coverage. General liability, professional liability, and animal care insurance are essential for covering potential risks. Implement standard operating procedures (SOPs). Establishing clear procedures for care and safety can help prevent negligence claims. Ensure proper training and supervision. All staff members should be adequately trained, and their actions should be monitored to prevent incidents. Why is it essential to provide clients with clear and comprehensive post-treatment instructions, and what key information should be included in these instructions? Answer: post-treatment instructions are crucial for ensuring that the animal receives proper care after a procedure or treatment, preventing complications and promoting recovery. Key components of post-treatment instructions should include medication instructions. Provide clear guidelines on how and when to administer any medications, including dosage and potential side effects. Activity restrictions. Outline any restrictions on the animal's physical activity to prevent further injury or strain, e.g., limited exercise after surgery. Signs of complications. Educate the client on warning signs of potential issues such as infection, allergic reactions, or abnormal behavior, and when to seek further medical attention. Follow-up appointments. Specify the date and purpose of any follow-up visits and explain their importance for monitoring the animal's recovery. Contact information. Ensure that clients know how to reach the provider in case they have questions or concerns during the recovery process. Providing these instructions in writing, along with verbal explanations, increases the likelihood that clients will follow them correctly and ensures the animal's optimal recovery. What is the legal responsibility of an animal care provider when they suspect or observe animal abuse, and what steps should be taken to report it? Answer: animal care providers have a legal and ethical obligation to report suspected animal abuse. Failing to do so could result in legal consequences for the provider and further harm to the animal. Steps to take when reporting animal abuse: assess the situation. If abuse is observed or suspected, document any signs or evidence of neglect or harm, such as physical injuries or unsanitary living conditions. Report to authorities. The provider should contact local animal control, the police, or relevant humane societies immediately. Some jurisdictions have hotlines or online reporting systems. Follow-up. In some cases, the provider may need to follow up with authorities to ensure that the situation is being addressed. Providers should be familiar with the specific reporting procedures in their area and ensure that they report abuse in a timely and thorough manner. How do regulatory bodies in animal care influence the industry, and what role do they play in ensuring the welfare of animals and the standards of animal care providers? Answer: regulatory bodies in animal care, such as national or local veterinary boards, animal welfare organizations, and government agencies, oversee the compliance of animal care providers with established laws, regulations, and industry standards. Their role includes setting standards. Regulatory bodies define the minimum care standards that animal care providers must follow, ensuring animals receive proper treatment, care, and protection. Licensing and accreditation. These bodies are responsible for issuing licenses and certifications to qualified animal care providers, ensuring that only those who meet specific educational and professional standards are permitted to offer care services. Enforcing compliance. Regulatory agencies investigate complaints, conduct inspections, and enforce penalties for non-compliance, helping to maintain high standards of care across the industry, advocacy, and education. Regulatory bodies often advocate for animal welfare policies and provide educational resources to the public and animal care providers. How should an animal care provider address a situation where a client expresses concerns about the cost of treatment for their pet, especially when the provider believes the treatment is necessary? Answer: when a client expresses concerns about treatment costs, the animal care provider should empathize with the client, acknowledge the client's concerns and emotions. Many pet owners view their animals as family, and the financial aspect can be a source of stress. Explain the necessity of the treatment. Clearly explain the reasons why the treatment is necessary, including the risks of not proceeding with the treatment, the expected outcomes, and how it will benefit the pet's health. Offer payment options. If possible, provide flexible payment plans, financing options, or information on pet insurance to help ease the financial burden. Provide alternatives. In some cases, the provider can offer alternative treatments that may be more affordable, provided these options do not compromise the animal's well-being. This approach helps to build trust with the client while ensuring the animal receives the necessary care. What strategies should an animal care provider use to build long-term, trusting relationships with clients, and why is this important for the success of their practice? Answer: building long-term relationships with clients involves consistent communication. Regularly check in with clients, especially after treatments, to ensure they are satisfied with the care provided and to address any concerns. Personalized service. Tailor care and advice to each client's individual needs and their pet-specific requirements. Transparency and honesty. Be open about costs, treatment options, and the potential outcomes. Transparency fosters trust and minimizes misunderstandings. Professionalism and empathy. Treat each client and their pet with respect and understanding. Show empathy, especially when the client is experiencing difficult situations with their pet's health. Building strong relationships enhances client retention, encourages referrals, and contributes to the overall success of the practice. Trusting clients are more likely to return for future care and recommend the provider to others.